once again, and welcome back to the Only You, where we discuss mental health and mental wellness with myself, Vince, here at the house today because I had a sick doggy at a vet appointment, and of course, Dr. Patino in his office. How you doing today, Dr. Patino?
It's been a great day, a great week. We just had a long weekend observing Martin Luther King's birth anniversary, and I think that um, we're back to the reality of still being in a pandemic, right? I mean, that's um, every time we have a little breather to think about what do we want to see in the future, we always get kind of pulled back into reality by what we're dealing with, and different than New York and Boston and some of the New Hampshire areas who are going down now on the Omicron, we're going up. So it is our turn to be stressed by this, and it's just a reminder, that uh, this stuff of the pandemic has serious consequences. And for me, as a psychiatrist, having to deal with this on a day-to-day basis and working in the hospital, more reminders, right, that we have a crisis, and we are probably going to get over the pandemic hopefully soon, but it's going to take time to get over the crisis in mental health from the pandemic.
Do you think that the change in the reality? We were chatting before the show. My in-laws were we unfortunately going to a funeral this week for one of them. For the longest time, completely denied that COVID existed, and part of it was because they had no direct experience with it. But with this new surge, now most of their friends are sick, and it's changed everything. They've actually asked people to wear masks at the funeral, something that was verboten in their home all these years. But do you think that new reality check, in a way, as you just mentioned, that new reality, pushing it, is going to help certain people accept the realities of it and then maybe have some more compassion for the negative effects of anxiety and depression in others?
When I look at statistics and I look at the numbers of people that identify themselves basically anti-COVID, anti-vaxxer, anti-reality, the numbers are not very large in comparison to people who recognize that COVID is real. The problem, I think, has been twofold. One has been the misinformation that a lot of the people who are ambivalent, right, in terms of how to identify themselves, because there's been a tremendous push to have a political identity attached to being against COVID, being against vaccines, right? So that is one side, and the other side is that I don't think that we have done a very good job on um, allowing the science to be transmitted by the physician and the physician assistants and the nurse practitioners and the nurses, right? So the CDC has made an attempt to provide useful information, but there's no substitute for the one-to-one interaction with an individual, right? That the patient or the individual is willing to sit down with a professional and have an open, reality-based discussion about risk and benefit, right? That has not happened. So we have polarized the situation, but I do see after Omicron became the most prevalent variant in the United States, I do see that the numbers of people vaccinated went up.
Hmm.
Okay, and the reality and the massive amount of people who are getting infected nowadays um, is pretty astonishing, and people are starting to see people close to them getting sick, right? So I think that this is sad state of affairs, that we have to see more people getting sick and more people dying, so we can say, well, maybe it's true. And again, it is sad. um, we really have to take some personal responsibility, right? Um, and not try to find just specific individuals or sets of people so we can put a blame into. And that is because that is a very easy process of projection, right?
Mm,
It is not my problem, it is other people's problem. And it can only be my problem if somebody else is responsible, right? Our reality, my reality every morning is just my reality, and I have to be responsible for it. But I also have to have some sense of responsibility, um, to protect those that are around me, right? Now, I can't protect those who are around me if I don't protect myself first. And we're having some questions where people are wondering, is the media, there are people who cannot wear masks? Yes, I think that not 100% of people can wear a mask, but the people who are not wearing a mask because of the same nature of the medical issues they have, they require more protection, right?
mm.
So this is not, I mean, and I've said this in a number of programs before. I do believe that the issue of vaccination and protection is a medical issue that has to be managed and discussed between the patient and their medical provider.
So not the media, not your politician, not your best friend, not the guy on YouTube, except for maybe us. But really, but you are a doctor, so there you go, right? But really, that one-on-one interaction with a provider, especially a GP who knows you well.
Well, let me give you an example. We have media on one side that is telling us that this is the end of the world. We have media on the other side that tells us it does not exist, right? And then we have people lying in the middle, right? Um, I think it's important that we recognize that we're taking a risk. You see, if you come to the hospital and you have abdominal pain and you have appendicitis, right? And you talk to the physician, I don't think it's the job of the physician to tell you that you have to operate, right? But this is a responsibility of the physician to say, if you don't operate, you're likely to die within the next week, right? And this is how it's going to happen. It's going to be painful. You're going to have a fever and septicemia, right? But it's your choice if you want to have surgery or not, to a point, right? Because if you get septicemic and you get into a coma, maybe one of your relatives will say, "Well, now you can operate under my permission." So yes, it is our body. It is what we put in our bodies has got to be, um, our responsibility, but we have to do it based on reality, on the reality base of what is the risk versus the benefit, right? I mean, every decision we make as physicians is based on that. I mean, I just find it fascinating, right, that we have a number of, um, kids, for example. You cannot be admitted to the school if you don't have your vaccination card. Remember the
Oh yeah,
vaccination card?
I remember the vaccine. I have that little scar from the polio one too, or whatever
And
that
we
was.
have had
Yeah.
people anti-vaccination for a long time, and there are laws in every state, based on that. I don't understand how COVID is different, right?
Well, yeah. But
Well, how is it different? That is being politicized,
exactly.
okay? And in some parts of the media has been used as a tool for enrichment. I mean, I just find it cynical and uncaring for people who are in certain media outlets advocating against vaccines, and they're vaccinated themselves because their employer requires that they take the vaccine, right? So we know they're vaccinated because it is required in their place of employment, right? But they're still selling, I mean, it just reminds me of some of the ads that I see: kill Dr. Fauci and give me $5, right? Politicians doing those things.
Wow, that's
I
crazy.
mean, that's insane. I mean,
Yeah,
it is.
literally advocating violence against another human being.
I mean, yeah, advocating violence for profit. I mean, it. You see, violence have always generated income
Mm,
at all different levels, but we have kept it away from individual responsibility, right? So I think that we're going to survive this pandemic, and there are going to be a lot more people being vaccinated by their choice, right? Now, we get into a serious issue when it comes to who is responsible for making the decision of vaccinating teenagers.
Mm.
Is should it be at what point is it the choice of a teen to say, I want to get vaccinated? And what happens if the parent says no, right? And we're finding that, I mean, because I see adolescents all the time, that becomes a major point of contention nowadays because of the same situation that the parent and the child are not going to the family doctor or pediatrician to have a discussion, right?
Mm.
About risk and benefit. And it's going to become more of an issue now that we're going to start vaccinating soon kids ages 2 to 5, right? So I think that the parents and all of us need to stop functioning out of fear, right? I mean, all of this, I think, is a significant base of fear, right? That it translates and gets projected in the form of aggression and in the forms of avoidance, right? So the easiest thing for me to do if I'm afraid is to either be aggressive or be avoidant. Yeah. So I think that um, we in the United States, in particular, statistically, right, we have more than 25% of the deaths in the world, and we only have 3% of the population. Something is not right there, right?
Oh, yes.
So, how can we have 25% of all the deaths in the world and only 3% of the population? What happened to us? How did we allow this to happen?
You did something significantly wrong. And to that point, as you mentioned, fear, which is a healthy thing at certain levels, once it turns to aggression or avoidance, it's bad. So, in your world, anxiety, depression, all these things. I've talked to my GP, and I know people work in ICUs. They tell you what's going on. They're overwhelmed. What's it like in your office these days?
You see, we have we have to understand that for us in the medical health profession, it's very demoralizing, you know, when you I mean, I showed up in the hospital this morning into our adolescent psychiatric unit, right? And we have approximately 48, 49 patients this morning in three different units with approximately 15 kids in isolation from COVID, right?
Mm.
Let me give you a number. Before December, we have never had as many kids with COVID in the hospital, in the psychiatric hospital, as we did today, right? Half of those kids are not vaccinated because their parents didn't want them to be vaccinated. So we get into these issues, right? That the nurses, the social workers, the administrators get very frustrated. And frustration leads to demoralization, right? So I think it's important that we are sensitive, right, to the fact that not only health professionals are getting sick with COVID because they're getting infected when people come from the outside, but a lot of people are quitting their profession, right?
Mm.
Because they're demoralized, because they're depressed, because they're tired of seeing people dying. In our lifetime, we've never seen anything like this. I mean, I don't know how to say it, but I mean, 850,000 people dead are a lot of people,
It is a lot.
right? And the statistics tell us that uh, because of the lack of vaccination, right, we probably had an extra 150,000 deaths between July and now. Okay, so yes, if you take it at the individual level, a lot of people got sick with COVID and nothing major happened to them, right? Um, But I think that I'm seeing a lot of that projection and paranoia from people on the outside trying to find somebody to blame, right? but nobody taking personal responsibility to protecting themselves and others. And we have the tools to do that. I mean, people, and I'm seeing it in the questions that we're getting right now, people still want to litigate the safety of DNA vaccines, right? Purpose, right? I mean, do you still hear in the comments like, not all the deaths are from COVID, right? Yeah, and so there's a lot of misdirection, okay, and again pointing the finger and saying all of you who are talking about protection are wrong,
Mhm.
right? But what is the purpose of doing that? What are we trying to accomplish by pointing the finger and saying, is the pharmaceutical companies, is the government, is the doctors who use one power and control, is all about manipulating us? Purpose. What is the purpose of that? Right. So, yes, one of the persons who's sending us a lot of questions said one of my friends had a heart attack and the death certificate says COVID. Okay. Let's say that there's one less person who died from COVID. How about the other 849,999? Right. So, I mean, we start getting back into the conspiracy theory that if one person died from a heart attack and the certificate says COVID, then all of them had
Yes.
heart attacks and COVID, right? So again, that's the irrationality of this whole process. That there is no way for people to really have a rational dialogue without pointing fingers, expressing fear, yeah, and rejecting, right? Okay, any of the rational virology, DNA vaccine management, you know, trying to stop being afraid. I
So
mean, I really want to welcome people to stop being afraid and to take the risk of considering the possibility that this is real, that the 150,000 people, most of them probably died from COVID, right? Um, Without having to have spend some time in the ICU, right? Looking at somebody who can't breathe and is probably going to die. And I'm now being told, well, not everything is COVID. Absolutely not. I said it before. From the hospitalizations we have right now in medical hospitals, about half of the COVID cases that are hospitalized were found by accident. They're there for another reason.
yeah,
But
you were saying that.
that's not true for the first, second, and third waves. That's Omicron, right? That's today. But again, I really find it fascinating that we are litigating, okay, with political irrational arguments, the reality that we had a catastrophic management of COVID, primarily because people not wanting to be responsible and not getting their vaccines. And that's going to continue. I don't expect 100% of people in the United States to get vaccinated, but we need to get up to about 85 to 90%. We're going to have solid anti vaxxers, and some of them are politicians, and that we're going to continue having the media basically making money out of fear. But that's not a new concept,
No,
right?
that's been going on forever.
I mean, some of the safest population in the world are the elderly, right? But they're the ones who spend the most money on safety, alarms and all kinds of different things because there's all fear. Statistically, most of the crimes don't happen with the elderly. Most of the robberies don't happen with them. Right?
Yeah, I deal with that every day in my other job. People
Hmm.
are truly believe that someone's after them, and I always ask the question. I said, unless you can describe specifically who's after you and why and how, they probably don't exist.
Hmm.
And just be real about it. But back to the point of what you do for a living. And we have all these people in the ICUs. We see that we can look at that as data. But how is it affecting your office and your psychiatric? Now, obviously, you have some people that are COVID positive, so there's some logistic issues. But from a mental health perspective, what do you see? Is there a direct effect of COVID just existing, increasing anxiety and depression, or has it been relatively consistent?
Well, no, the demand for services in psychiatry greatly outnumbers the availability of services, meaning we get a lot of calls on people who have never seen psychiatrists or psychologists or therapists before that want to talk to someone, that feel stressed. Significantly outnumber in people that work in healthcare and people who work in fire departments and people that work in nursing homes. So the demand for services is very high. Now, we can't provide services for everybody. There's not enough of us, right? The number of patients and adolescents admitted with significant depression and suicidal behavior is tremendously high, right? So we have to pay a lot of attention to that. And you and I were talking about this before we started, and a lot of it has to do with the fact that I believe and I'm hopeful that we're going to get over COVID within the next 6 to 12 months. However, the mental health crisis generated by COVID is going to take a much longer time to get better. In particular, because we have vulnerable people. We have people that already had depression before COVID. We have kids that are dealing with domestic violence, that are dealing with alcoholism and drug abuse in their homes, the physical violence in the home. Kids are being chronically neglected, uh, and they find themselves very hopeless. Right? I mean, I've been doing this for more than 33 years now, and I can tell you that never in my career I have seen as many kids telling me, "What's the use?
Mm,
What's the purpose of me being in this world?" I mean, we're not selling hope very well. We're just still feeling selling so much fear that these kids basically say, "What for?" You know, I don't see anything positive. I don't. Not only they don't see anything positive in their future, they don't see anything positive in themselves,
mm,
and that's tremendously sad, right? So we have to. I mean, we have to take the opportunity of this crisis to rethink how are we going to help these kids having some hope, because we had a confluence of issues. We have a confluence of fear with the confluence of COVID. We had the confluence of overparenting, right? And these kids find themselves feeling terribly unaided. They don't feel they have any tools to deal with any of this. You know, millions of kids have lost their parents. In the world, millions of kids have lost their grandparents in the world, and they've never sustained losses before. So it's not COVID, it's not their virus, it's how fast this has happened and how intense it's been. And that has created a problem, right? So it becomes very important that we stay focused on purpose. And we've talked about this many times. What are we trying to accomplish, right? Are we trying to accomplish that you know better than me? Are we trying to accomplish that your leaders are better than my leaders? Are we trying to accomplish that your politics are better than mine? What purpose does that serve? Right? So we can extrapolate that into a lot of different purposes, but the reality is that we have to stay focused on two basic things, you know, survival and contentment. Let's stay alive and be content with having ourselves, okay, and then giving ourselves to the rest of the world as healthy people. But all I'm hearing from all different sides is, how are you going to fix me?
mm,
How are you going to give me the tools so I can be content? And I keep and I say this in the hospital all the time, right? All the time. Look at the mirror, because that's all you have. Don't look at me. I can tell you what I think about what your issues are, but the solution is not with me, it's with you. So look at the mirror, right? And let's look at how we can facilitate the process, not event, process of somebody learning how to live with themselves and to realize that they're valuable human beings, right? I deal with suicide every day,
mm,
every day. I mean, and I've been doing this for 33 years. I've never seen it as intense in terms of not only feeling so bad that you think your life isn't worth living, but having the intent of saying, what am I alive for?
What do you think attributes to that? I guess a culture or a culturation that brought us to this point that these kids just don't think there's any value. Was
Well, and I think that's part of the overparenting failure, right? That we have sheltered these kids so much that we have not given them the opportunity to take risk and to experience, right? And now they're demanding the shelter from everybody else,
mm,
right? So we need to start learning and allowing them to learn the how to, right? And that's going to require a lot of parental facilitation too, right? And I'm not saying that parents have done the wrong thing. I think that 99% of the parents are well intentioned, but I also think that it's very important that parents understand that there's no substitute for risk taking, right?
well, they,
Calculated, protected risk taking.
well, safety net is a word that's used a lot, banting around. It's
Yep.
literally that. It's not supposed to be a hammock, right? You want them to climb. You want them to take the safety is there if they fall. I think you're right. A lot of parents have decided that you don't get to even climb. I know as a kid, I'll be honest, my mother, when she was not being overly neglectful, was overly protective. And so you know what I found myself doing? Rappelling off of bridges when she wasn't looking, quite literally, doing things like that. I chose to do those risk taking myself. And I think some kids do that and they rebel. I think, but now, because you can't really get away with social media and connections and communications, it's really harder to do that. Actually, go take those risks sometimes because the helicopter parenting and all the controls.
Yeah, you see, once you get to be 13 and older, it is usually an age in which the friends become more important than the parents. And all of a sudden, you get COVID and you take the friends away,
Mm,
right? So all you have left is the parent and the child. And the nature of adolescence is separation. And how do you separate between 13 and 18 if you can't separate because you're restricted, right? And this is all over the world. It's not only in the United States. So we end up seeing a lot of conflict, right? And lack of understanding on both sides and lack of recognition of what each side needs, right? And it's very easy to become projecting into the person in front of you who's close to you that don't have a choice all your frustrations. So it's not just the kids, it's the same. The increase in domestic violence, the increase in substance abuse, the increase in divorce, and there's more to come, right? Because we weren't accustomed to spend so much time together. And listen to that phrase. It
mm.
doesn't isn't that sad
Very paradoxical too.
that we don't know how to be together? Right? It means that you we weren't really focusing on purpose, right? So we all have been challenged with the idea that we can be away 8 hours a day, 5 days a week, or 9 or 10, right? Now we're in the same box. And we start to realize that we're getting to know the people that we've lived with forever. And there are a lot of things about them we don't like. And that's okay. I mean, I've said it many times before. You don't have to like the people you love. If you feel obligated to like the people you love, you're going to run into a lot of walls. You're going to run into a lot of trouble because we have to be allowed to be disliked. But that's a two-way street. Okay. If you don't like me, I'm okay with that. You don't stop loving me.
Mm,
And that's a conversation we have to have with our kids all the time because the kids think, especially as teenagers, that if you don't like them, you don't love them,
mm,
right? So it's important that we become more participative, if you may, right? But we can do that if we don't listen. And that goes back to another principle we have used for a long time in this podcast, which is listen more and talk less. You don't learn anything where you're talking, right? Um, so we really have to balance things. We can't fix this. We can balance it, okay? So we can be comfortable, miserable.
Yeah, adapt to the situation, as you said, because survival is the initial thing.
Exactly.
It's interesting what you said, and you've said it before about not having to like the people you love. Maybe if we could use that concept of compassion that we've talked about for the new year and extend that maybe that's what we have to do when we do encounter people that have different viewpoints of ours than ours at this point, in particular over very sensitive items like COVID and the like. That you know what, you may not like what they have to say, and we may not agree with it, but that's still another human being over there. And if we could
Yes.
provide some compassion and remember to love them first and then deal with the liking part later, it might make it a little bit easier for us to manage our current situation.
You know, I tell my friends all the time, and most of my friends have grandkids now, right? And I told the friends of my children to listen. If you having a hard time with your kid, it's okay to tell them you don't like him, but open your arms and tell them, but I can give you a hug. Okay, it doesn't have to be an excuse to reject each other. And this becomes a major issue in terms of the communication with kids.
Well, I think that's what's
So
going on with our society right now. We've gotten to the point where because we don't like what each others are saying or doing, that we've decided to hate one another instead of just accept, okay, we don't agree, but we can still, be a country, we be a nation, we can be humanity, and move along.
I was looking at one statistic before we go, and it's going to be just to plant a seed on people's heads. And I was looking at the statistics of young people ages 18 to 29 and looking at their voting, okay, increments since the 1980s, right? In the 1980s and 90s, people ages 18 to 29, the number of people who are voting were probably about 20-25%. Do you want to guess how much they voted in 2020? 57%.
It's growing, absolutely,
And if you look at the political leanings of those kids, you're going to see why people are getting so paranoid,
absolutely.
right? It's because we're seeing this trend of the only population, besides Hispanics and African Americans, that the response to voting is growing, right? So there's a lot of people afraid out there,
Yeah,
but I
and
think
they
they need to stop being afraid.
But I will say, I know personally when I talk to my stepkid, she's 20 years old. I have hope. A lot of the hangups that they have, or the older people have, they don't have. They don't care about sexuality, race, this, the like. They know that the information they're getting on their computer or on their iPod or their phone is algorithm driven, so they're not fooled by it. And it gives me hope for the future because you know what? Those kids do have compassion for one another, and we talk a lot about that being the next step. To those who were asking questions, and we really appreciate it. We have quite a few popping up. We couldn't get to everybody's and respond to them all. I think Dr. Pino looks like he's going to be typing some answers here. But please do sign back in on our next show next week, and we'll continue along. Again, thank you, Doctor, once again for your time. Thank you out there, listeners, for your comments, and have a great week. We'll talk to you soon.
Thank you, Vince. We'll talk to you soon. Take care.